hard balance to make. But some of these things are going to drive up the cost. And I brought this Wall Street Journal article yesterday as the top story, health insurers plan hikes. Lead story, Dallas Morning News had a story yesterday in their business section about how some small business insurance companies are going out of business. They can't keep up with all these mandates because the way they operate, just to be low cost. So it's all over the news right now. Now, the Wall Street Journal article pointed out Aetna, Nevada, and California, because of this bill, their premiums will go up 5 to 7%. And they're going to go up even more just because medical costs are getting so expensive. We do have a lot more treatments and they're expensive. But they do attribute 5% of the cost to this. Some of the interesting things, rating variation based on age, it's limited to a 3-to-1 ratio. I thought the tobacco use, you don't hear much about that. But if you do smoke, then your rates can't go up a certain percentage as compared to somebody who doesn't, even though we do know that smoking causes quite a few health problems. So that's going to be a problem. I think people who don't smoke are going to be on the hook for paying for people who do, in a sense. Medical loss ratio, this is probably pretty confusing. You're going to hear a lot about this term. What that means, if it's an 85%, that means 85% of what you're paying for your insurance must go towards your medical care. That's another reason why health insurance agents may go out of business, because in the individual market, it's competitive, and insurance companies will pay a referral fee to health insurance agents. And part of that, so that's going to eliminate a lot of the referral fee right there, and that's going to eliminate advertising of insurance companies. So all these plans, especially the HSAs, there are a lot of non-medical costs involved. They're going to have to look at this and see what this means for them in the future. So a lot of the small plans, some of them are based here in Irving area. They may not be able to meet these medical loss ratios of 85%. So I think that those are things to look out for. So if you are an employer now offering coverage, you're going to want to figure out, what does qualified coverage mean for me? Will I keep my grandfather plan? So going forward, what are the new ways to get health insurance starting in 2014? You've heard, this is really the centerpiece of the bill, the health insurance exchange. Don't worry about reading that, it's pretty boring. Let me show you a picture of what it looks like. So when I worked for the federal government, we had the federal employee health plan. It's modeled a little bit after this. And I will say that a lot of conservatives like this idea too. President Obama said that, he was right. A lot of think tanks are for this, but they would have done it differently, allow insurance to be purchased across state lines and other ideas. So it does differ in a lot of regards. But the idea is the state of Texas will be required to set up an exchange, a cafeteria-style plan, by 2014. If the state doesn't do it, then the federal government will do it for the state of Texas. To date, Massachusetts already has one. It should be qualified. California passed one last week. So Texas legislature meets in January. We should have one. They should start talking about it then. And the question is, who will set it up? Department of Insurance, will Department of Health, or will the state create a whole new entity to oversee it? Those are some big questions. So the idea is that the Office of Personnel Management in Washington, the federal government, will contract with the private insurers, and each state will have to have a certain number of plans in there. So for example, you'll go to the website, you'll see a plan by Blue Cross Blue Shield, by Aetna, et cetera. Hopefully there will be quite a few. President Obama's idea was all these competing plans would have to make things competitive. So you're probably wondering why all the different colors and why all the numbers. So Platinum plan, the top plan, the 90% actuarial value. That means that about 90% of the medical costs will be picked up by the plan and 10% will be picked up by you. So remember I talked about the Silver plan earlier. And that's really the benchmark for determining if you have to pay a penalty if somebody found a better plan, but that picks up 70% of the costs. And then there are catastrophic plans available for people under age 30. That's a problem because I'm 32 and I haven't had any health problems, so why can't I do it? They just choose number 30. So that's going to be a problem going forward for a lot of people, but this is what it looks like. You'll hopefully have 2 plans from the Silver, for example, 2 from the Gold. They'll have different prices. Now the idea behind it was they're competing against each other in a marketplace. Well, you already have ehealthinsurance.com. Technically, they're competing against each other. Will this make health insurance cheaper, more affordable? Well, there really aren't any caps on how much they can charge. It's up to the regulators. And then the other problem is the states can still put all the mandates that they want on this. I think if you live on the Texas side of Texarkana, you have twice as many mandates as living on the Arkansas side of Texarkana because of state government. So New York Times had a great story again a couple months ago about the state of New York, so many mandates in that state that it's not going to control the cost necessarily. And you're probably asking yourself, is this going to be for my employees or do I want to get into it? Well, I think in order to be competitive, what the insurance companies are saying, they're going to have to offer a very small network of providers. So your current plan may have 5 hospitals within the network. Well, these might just have 1 hospital. They do a lot of negotiating with the hospitals and the providers to get the costs as low as possible. So that's how they're going to try to make these competitive. So I really wouldn't view these exchanges, each state exchange, as a way to keep costs down. We should probably view it more, and this is what the insurance company and most healthcare companies will tell you, it's really more of an avenue to determine if you're eligible for subsidies from the federal government or not. Because the first thing you're going to do is you're going to type in your info, and the first thing this exchange will do is figure out if you're eligible for Medicaid. If you are, then you're done, you're on Medicaid. The second thing it'll do is determine if you're eligible for a subsidy. If you're a family of 4 up to $88,000, if that's the case, you'll get a tax credit that goes directly to the insurance company. I'll show you how that works in a minute. So if you're earning more than 400% federal poverty level, there are no subsidies for you. This is really confusing. It took me a couple hours to figure out what it all meant. But this is what the subsidies look like. So let's say you're 350% federal poverty level, family of 4, let's just say it's $75,000 a year. So this means your premium is capped at 9.5% of your income. You won't pay more than that. So that means your monthly premium really won't be more than $611 a month. It's still a lot of money. So as you can see, it's not bringing costs down. And the actuarial value of that silver plan is 70%. So that means you won't pay more than, or the insurer will pay 70% of your medical costs. Now, if you're right above the poverty level, right above Medicaid, then they'll pick up 94% of the costs. You won't pay more than, let's say, $74 a month. But to be eligible for this subsidy, you have to have the silver plan or better. So big companies have been talking about it. I think AT&T has already done a study. Congress subpoenaed their documents on it, and then they realized, oh wait, we don't want to make this public, because they were saying, well, it might be cheaper for us to just drop all our employees into the exchange. I think AT&T, don't quote me on this, but I think they're paying about $2.4 billion on medical costs right now, and this could end up being about $660 million for them medical cost-wise. So why would you not want to do it? Like I said, you may have much tighter networks, provider networks. Your employees may not like that. That might not be a good recruiting tool. So that, I hope that makes sense. It's a little complicated, but picture that as the exchange. The state of Texas will have a major role in it. So you're going to read a lot about that this winter in the legislature. Small business tax credits, Gary's going to get into that. This is the fun process to go through to figure out if you're eligible for it. These are the 4 scenarios. I don't really want to walk you through it. It's pretty difficult. And so you have a lot of he said, she said. The White House thinks that 4 million small businesses will be eligible for this. NFIB, National Federation of Independent Business, does not think that more than 2 million small businesses will be eligible for this tax credit. And I don't know that any of y'all would, because the income test is so low. So just some of the questions going forward. Congressional Budget Office, it is nonpartisan, not affiliated with either party, indicated about 9 million Americans will no longer have their current coverage. It'll probably be replaced by a different option. Small employers terminating their plans. Hard to determine small employer, but state of Texas, I think it's defined as 100 or fewer employees. 14 million people could lose their current employer coverage by 2019, and that's coming from Medicare. And they just released a big report this morning on this as well. And grandfathered plans, as I said, anywhere from 39 to 69% could lose their current protected status. Well, we have higher premiums for consumers. Mandates lead to new costs, so that's definitely a real possibility. I already talked about medical loss ratio. That's important to look at for it, I think. Some of the more creative plans right now, child-only coverage in New Jersey is a better deal. I think in New Jersey, all the health insurance companies offering child-only plans quit doing it because of some of the new rules. HSAs, I just thought about this at the last minute. I have one. I'm sure most of you all have them. They didn't kill them, so you're in good shape there. The flexible savings spending account contributions, you're going to be limited starting in January. And as I talked about the medical loss ratio definition, will that hurt HSAs and high deductible plans down the road? Massachusetts, you've heard a lot about it. Mitt Romney, when he was governor, passed this. Some people kind of kidding, but kind of serious too. They said the biggest loser of this whole healthcare bill will be Mitt Romney as he tries to run for president, since he passed this and now it's not very popular. The biggest problem, the top right there, 60% of the states remaining uninsured are under the age of 35 because they're just waiting until they get sick. I think their penalty now is about $1,300 a year for not having insurance, but they're finding that to be a better deal. And just this Boston Globe article in the blue box talking about how a lot of small businesses have started just sending their employees to the exchanges they have in Massachusetts. So the outlook in Washington, don't believe what they tell you on AM radio. This isn't going away. Even if Republicans take over Congress, President Obama will still have veto power, so you can forget about that. There will be small things that'll probably be tweaked. Gary's going to talk about the 1099 forms. Congress has already looked into that. Will they get something done before the election? I don't know. Another small provision, doctors can no longer own new hospitals, which is huge here in Dallas-Fort Worth. We have more than any other city in America, physician-owned hospitals. I think a Republican-controlled Congress will change that. You've heard of lawsuits, state of Virginia or federal judge in Virginia allowed one to go forward. We'll see what happens there, but I think you need to focus on this. It's probably here to stay, at least for the meantime, and that just gives you some of the ideas. But takeaway items, learn about the exchanges. The legislature will start trying to develop one this winter, January. Grandfather plans, understand what that means if you can keep yours. And qualified coverage. Everybody's going to have qualified